Hi everyone, I'm Kelly from Physio Connections. I am both a physiotherapist and a lactation consultant. Many times, mummies do come in after they deliver with a few breastfeeding problems. The first most common problem will be very low milk supply during the first couple of days post-delivery. Fret not, this is just because your body is still producing colostrum and you are only expecting about a teaspoon in quantity every time you are latching. After that, you will be noticing an increase in milk supply. Usually that comes in about 3 to 5 days post-delivery, and some mummies do face engorgement during this phase. So some mummies actually just apply cold cabbages, ice, or even self-massage to clear out the milk. However, if the milk is not cleared out fully, it can actually lead to blocked ducts or even mastitis in the long run. So if you have a very bad engorgement or even blocked ducts that you are not able to clear by yourself at home, physiotherapists can also help you to clear out the blocked ducts using ultrasound. Sometimes mummies do also have sore nipples or even painful nipples when they latch. This is commonly because your baby is either not latching properly or they are actually biting on your nipples. So generally, when you latch, your nipples are supposed to go into the baby's mouth straight. However, sometimes when you try to force your baby to latch, your nipples can actually go in at a tilted angle, which leads to sore nipples in the long run. So some mummies do also feel back or even neck pain when they are breastfeeding. This is commonly due to bad posture during latching, which I'm going to show you the 4 more common postures that mummies do use during breastfeeding. So the first position will be the cradle hold, whereby you will be resting your baby's head near the elbow and then your hands near the buttocks or the legs area. So make sure you do have proper neck and back support and support your hand as well. So this way you do not strain anything when you are latching with your baby. Okay. Second way would be a cross cradle hold, whereby you are using the opposite hand to support your baby's neck and your elbow area to support your baby's buttock. Also ensure that you are having a proper neck and back support and do support the hand that you are cradling your baby on. Avoid slouching forward to rest your hands, as this can actually result in back or neck pain in the long run. The third common position will be a football hold, whereby you will be cuddling your baby on the side, and then you are just supporting your baby's neck and head, whereby your elbow area and your forearm is actually supporting your baby's back. This is commonly used for mummies who had done a C-section, as this avoids pressure over the wound area. So also ensure you are resting your hands and do not try to do this, because this can be very uncomfortable for your wrist. So you add in support for your wrist to ensure that you are actually just resting your hands. The fourth common position that mummies do use, usually they do it at night when they are night latching, is the side lie. So for side lie position, ensure that you have proper support for your baby as well as for yourself. Try not to push to support your neck with your hands, because it can lead to either hand pain or it can lead to strained neck in the long run.